Hello, my name's Kevin Harrington. I'm a professor in biological cancer therapies at the Institute of Cancer Research and at the Royal Marsden Hospital. For the last 10 years or more, I have also been a trustee of the Oracle Cancer Trust. I'm pleased to have this opportunity to share with you some of the visions that we have in the Oracle Cancer Trust for improving research activities in patients with head and neck cancers with the overall goal of curing more patients. At the same time as curing more patients, we wish to cause less damage to those patients we treat and overall to improve outcomes. So in the next 2 or 3 minutes, what I'd like to do is just to share with you the key themes of research that we are running through the Oracle Cancer Trust. The first area I'd like to tell you about is what we call imaging. That is the technology that we use in order to see the tumor inside the patient and to use that information to target treatment. As the great oncologist Mal Pankos said, the odds of hitting our target go up significantly when we actually aim at it. So one of the things that we do with cancer imaging is to use high-tech CT scans and MRI scans to see the tumor within the patient and allow us to develop our radiation beams in order to treat that more accurately. In addition to just seeing where the tumor is, we can actually see what the function of the tumor is within the cancer cells. So within any individual tumor mass, there may be 1 or 2 areas that are particularly aggressive and more likely to cause a bad outcome for patients. And we now have developed a series of scanning techniques that allow us to see those areas and to target them very specifically for extra doses of radiation. And in that way, we think that we'll be able to improve outcomes for patients. The second area that I'd like to discuss with you is the use of radiation technology. Now, in the last decade, we at the Marsden Hospital have been pioneering a completely novel way of delivering radiotherapy in the form of so-called intensity modulated radiotherapy. This is a way whereby we can target the radiation doses specifically to where the cancer is and try to avoid normal tissues. In the last 5 years, we have published a series of landmark papers that have demonstrated both the safety and the effectiveness of this new way of delivering radiotherapy. And in doing so, we have changed practice both in the United Kingdom and around the world. We have a number of visions of how we may take that research forward, again, to improve patient cure rates and to reduce the side effects of the treatment. The third area of research I'd like to discuss with you is the use of new drugs to combine with radiation therapy to improve outcomes in patients. Now, the drugs that we use at the present time consist of the standard chemotherapy drugs that many patients have received for the last 2 or 3 decades. We know that those drugs can improve the outcomes of patients receiving radiotherapy, but they cause almost as many side effects in the normal tissues as they do in the tumor tissues. In the last decade, we've begun to understand that cancers have specific genetic defects. And by identifying these defects and devising drugs that will actually target those defects, we're able to design treatments that will be specifically anti-cancer but not anti-normal tissue. And we've also been able to select drugs that can make the radiation work better. So our vision at the present is to combine novel drugs, new so-called radiosensitizing drugs, with radiation both in the laboratory and in the clinic. Now, in Oracle Cancer Trust, we're sponsoring a number of clinical studies that are involved in using these sorts of approaches. The fourth area I'd like to discuss with you is a completely novel way of treating cancer. We've known for at least the last 7 decades that viruses can cause cancer, but within the last 10 years, we've begun to understand that there are certain types of viruses that will grow specifically in cancer cells, but will not grow in normal cells. These viruses are so-called oncolytic viruses. Work in my lab and in other labs around the world have shown that combining these viruses with both chemotherapy and with radiotherapy can yield very great improvements in terms of the ability to kill cancer cells. We've been able to translate those preclinical studies from the laboratory all the way through to the clinic and have treated a large number of patients at the Marsden Hospital. Ongoing studies sponsored by the Oracle Cancer Trust are allowing us to develop these approaches even further with the goal of trying to improve outcomes for patients, again to cure more patients and to cause fewer side effects. The final area that I'd like to discuss with you is perhaps, of course, the oldest treatment for cancer, which is surgery. Again, with help from the Oracle Cancer Trust, we've been running a number of clinical studies in which we're improving the outcomes of patients from surgical procedures, allowing them to recover better function and to preserve the precious senses that are so highly concentrated within the head and neck region. I hope that in this very short snapshot, I've been able to give you a flavor of some of the important and groundbreaking research that we've been doing, sponsored by Oracle Cancer Trust. It is only through the support of donors who give us money in order to run these research projects that we're able to improve the outcome of patients with these terrible diseases.